Hi, my name is Dr. Kat Brown, and I'm one of the OBGYN physicians at Winona and also the medical director as well. I chose to specialize in women's health because I feel like every woman needs a voice. Every woman needs somebody to fight for her. And it's my mission to make sure that any woman who comes to me for care, that her voice is heard and that we address any issues that she's going through to help her through this transition and make it a little bit more seamless and comfortable for her as her body goes through this change. Actually, I have my own story to tell you about my own experience. As I started going through perimenopause and started suffering from symptoms, I went to my own physician who knew very well that I was a board-certified OBGYN. And I went to her with an inventory of my symptoms and what my concerns were, and basically said, I think I'm ready to start HRT. And ultimately her response to me was, you're too young. I don't do that without getting lab tests and getting hormone values. And then my rebuttal was, but I'm a board-certified OBGYN. I'm telling you, all of our textbooks, all of our literature shows us that we don't need to do hormone testing before prescribing. She didn't care. She didn't want to hear it. And then, of course, I went ahead, did the hormone levels that she wanted, and they were normal on that particular day. So she said, sorry, come back when you're older and you're suffering more. So I just really wasn't willing to take no for an answer. So often, so many women go to their physicians or their providers to try to get help and are really belittled and told like they just need to suck it up, or that this is a natural transition, that they don't deserve treatment, or that treatment's unsafe. And it's just frankly not true. So women deserve better. They deserve the care that they need that's individualized for them. And the fact is, if you're suffering and you're having symptoms and they're bothersome to your day-to-day life, then you're ready for treatment. That's the bottom line. You don't need to go through anything. You don't have an age requirement. It's all about looking at what you're suffering with and treating you appropriately to make your life a little bit better each day. And that's why I've really made focusing on menopause care an important part of my journey in caring for patients. At Winona, we prescribe bioidentical hormone replacement therapy. The benefit of bioidentical HRT is that we're giving your body back the identical hormones that it creates on its own. It's just no longer producing adequate supplies anymore. So these hormones are able to be incorporated into your system more readily, more seamlessly, so that you have an easier transition and you don't have to deal with as many of the side effects that maybe your mothers or older women that you know that have tried HRT had dealt with in the past. Our treatment plans are individualized. Each patient is unique, and what they need to help with their symptoms is individualized as far as their therapy goes with us. As a doctor focused on women's health, I've seen firsthand how life-changing HRT can be for women. So many women out there have been struggling with symptoms for far too long before they get the help that they need. That's why we're here at Winona to help you.